Well, it is a Wednesday. Happy Hump Day, everyone. Um, I was just, wondering about Florida participation in the ACA, the Obamacare. And it turns out that down here, where I am in Florida, approximately between 21 and 24% of people, so an estimate of 4.7 million, or about almost a quarter of the people in Florida, are using ACA for their healthcare. Now, what got me thinking about this percentage is I just ran across an article about HCA health system, which is pretty big here in Florida, and they are planning on trimming at least 800 jobs due to the fact that the ACA credits are not being renewed, or currently are not in the plans to be renewed, unless the lawmakers get together and start working on a deal. As we remember from the past, HCA used to be run by Rick Scott, our senator here from Florida, and at some point it was found liable of Medicare fraud and ended up paying over $1 billion in restitution and fines as a result of defrauding Medicare. But that was old. That's the legacy. ACA under Rick Scott, our current Florida state senator here. So if HCA is planning on trimming jobs and they're announcing that publicly, that probably means that other healthcare organizations are also ready to trim their workforce. And so at the end of the day, that's going to hurt who? It's going to hurt patients. You can sit there and you can talk about savings and costs, blah blah blah. At the end of the day, you're not going to save anything, because these patients are still going to end up filtering through a system, through the emergency system, and emergency system charges are a lot costlier than just seeing a regular doctor, or seeing preventative care, or even visiting a hospital for some kind of routine stuff. It's a lot cheaper than being admitted to the emergency room. Being that Florida has almost 1/4 of its population using ACA, we are looking at some really hard times coming up here if the government doesn't sit down and figure out how to solve this ACA problem. So Florida, red state, is in the same boat as many other red states. The rural red states are going to be facing the same challenges. We've heard of many stories of hospitals closing down in the last couple of years because, well, there's just not enough funding from the government to keep them going. All right, I'm going to go save some lives now. You guys have a good day. Bye.